Welcome back to Breakfast All Tuesday Dancing with Stars. Tomorrow, don't forget, it is coming up to 12 minutes away from 9 o'clock. Time to talk health now. And this morning we're looking at chiropractors. And while many patients are convinced of their effectiveness, others aren't quite so sure. Well, medical researcher Dr. Shaun joins us now. Good morning to you.
Good morning, Pippa.
Let's talk about what the research tells us, because that's your area of expertise, obviously. International research tells us that chiropractors are good for back pain.
Yeah, I just look at the research, and yes, they're certainly good for back pain. They're not brilliant, but they're as good as conventional medicine, and actually conventional medicine's not great for back pain. It's very hard to treat.
Right, so if you've got a sore back, you're looking at options. By
all means, see a chiropractor. They may well help.
Right.
Yes.
Not so good for other forms of pain or other medical problems?
Well, there are a number of other conditions that many chiropractors will claim to treat. I did a survey last year asking chiropractors in this country whether they would treat children with asthma and ear infections, and 2/3 said yes, they would. So the research shows very, very clearly that they cannot benefit those conditions.
What the basis for that would be, that these things are somehow connected to the spine?
Well, that's the basic belief in chiropractic, that everything, all energy runs through the spine, and you can manipulate the spine to cure just about everything.
What about necks? Because a lot of people would go and see a chiropractor if they had neck pain.
They would, and I would advise people to be very, very careful. There are hundreds of reports of severe damage from chiropractors manipulating necks.
And that's when you say that, I think of the whole kind of
the
clicking of all the joints and things like that.
It's that cracking, so it's a high velocity but low amplitude manipulation is what they call it. So it's in layman's terms, and that can cause stroke. It can dissect the vertebral artery, and there are at least 700 cases of severe problems.
Internationally,
yes.
700 cases?
Internationally, yes.
OK, I mean, that's a big number, but I guess when you're looking at the number of people who go and see them...
Exactly, it's a small proportion, but it is definitely... And, you know, if that was a drug, the drug would be taken off the market, put it that way.
Right, there is a risk there. Yeah. So if you have back pain, consider it, be concerned about your neck. The doctor issue is something as well. Many chiropractors will call themselves a doctor. That's right,
and that blew up last year, and it was a massive international story. A survey, again in New Zealand, from Andrew Gilby, found that 82% of chiropractors here called themselves doctor.
82%?
Yeah, but they're not doctors. You know, they're trained in chiropractic, which is fine, but I think in a medical setting, to call yourself a doctor when you're not a medically qualified person is misleading.
Would that be the same as a physio, for example, calling themselves a doctor?
Exactly.
OK. Let's talk about physios as well, because your advice would be to go and see a physio over a chiropractor. Yeah,
personally, that's what I would do.
How does the treatment differ for people who sort of think that they all fall into the same category?
Yeah, it's quite... But, I mean, physios are trained in the same sort of anatomy and physiology as doctors are, traditional Western medicine that we'd all basically agree with. And in terms of back pain, they would more look at rehabilitation and building up muscles surrounding the back and making it stronger. Whereas for chiropractors, it's really, as I say, this cracking... high-velocity manoeuvres.
So if you had a sore back, what would you do?
Physio and take some painkillers, and it'll go away after a few weeks.
OK. Shaun, Dr. Shaun Holt, thank you very much for that.
Thank you.
And just so you know, we will be getting the other side of the story from a chiropractor later in the week.
What, in case we doubt our doctor?
Well, last time we had Dr. Shaun on, he talked about something a little bit controversial, because this man knows a lot of the research.
He has written a book on the subject. So for all of those people who think I'm wrong and libraries are right, it's in a book. It must be true.
And also there will be a lot of chiropractors out there who don't call themselves doctors and don't claim to fix anything but to help with back pain as well.
So
right. OK. So the other side coming up.